Hi, my name is Sherry Franz. We're here at Center Line Veterinary Hospital, and we're going to get caught up on Courage today.
Energize, realize, feels so good just to be alive. Time's a gift, my time is free. I can spend it on you, you can spend it on me. I can say you'll be blown away by the change you see me. And I feel alright, dance all night, put a little flavor in my life. I put the good stuff in.
This is Courage. He is a rescue. Yes, someone found him in a box with a ginormous head, infected head. You couldn't even see his eye.
Oh my God. Oh, this is not good.
I know, you see all that blood?
Yeah, this dog needs to see a vet immediately. Two kind Samaritans found him. As you can see, he is severely injured.
He was just not a puppy at all. We ended up taking x-rays of his head, and he ends up having a broken jaw. Yes, I love you. He had a severe infection, as you can see, the drain tubes. And we were afraid of this eye. We may not even be able to save this eye here. We're waiting to see if it clears up. The infection clears up. Hopefully we can save it. If not, he may need to be enucleated. But he is just the sweetest boy ever too, man. We love you, my boy. Yes, we do. And he's, oh my gosh, a ton better than he was when we seen him, man. He was a mess. Yes, you were. You was a mess.
So we had our board certified radiologist come in, and we sedated Courage and took some more x-rays, and it's healing nicely. He's doing great. The radiologist had said when Courage was originally presented to us, the wound might have been a week and a half, 2 weeks old, which is really heartbreaking to know that this little guy for 2 weeks was in that much pain.
Okay, so now
Megan.
we'll look at a couple of things. Anytime we're looking at an x-ray, a radiograph, anything that's black is air, like the air surrounding our baby, and anything that's whiter is something that would absorb x-rays, like lead letters, bones, or soft tissue. So keeping that in mind, this is the radiograph, or one of the radiographs or x-rays we exposed initially on the 29th of last month. And we're looking and we can see the this area here where this mandibular fracture is. We see a degree of bone, a jaw fracture. We can see some bone starting to want to heal and remodel in here. And here we can see where the break is. The other side, this would be the right side, this is the left side. The other side, as you can see, is nicely lined up. We are also seeing here on the top of the skull some area here where we're suspicious there might have been some injury here around the frontal sinus. We're seeing some gas under here, which we noted. Along with other soft tissues, there was gas and pus, and I believe it's coming here from the sinus. We see all this soft tissue swelling here, which was that abscess that we had seen. This structure here, that's the trachea tube. The trach tube. The baby was under anesthesia while we were doing this. Let's see, look at our next radiograph.
Can you extrapolate, though, the type of trauma from when you, I mean, are you somewhat of a detective, too? So when you see all of this stuff, you try to, like, piece together, well, how does this happen, you know?
You try, but sometimes it's hard. And so it's at this stage, you don't know. It could be anything. It could be some fall. It could be a dog fight. It could be some other type of trauma. It's hard to say. Mm-hmm. We're looking here. We can see here. This is called the zygomatic arch, and we can see here on the affected side that there's a fracture there, which is consistent, which just makes you wonder. Then here's the area of the fracture. We also noticed it when we had this baby under anesthesia that one of the teeth on the mandible or the jaw was fractured as well. And once this is healed up, then we will take care of that and get that fractured tooth out. So then if we go back here to today, or go forward I should say,
So this was just today, some fresh
So
rays.
these radiographs were exposed today. We can get this up to full size. We could even make it bigger if it makes it easier.
Oh, that's great. Perfect, yeah.
We see even more of what we call periosteal reaction. This is the fracture zone. And it's doing okay. Here's that fractured tooth, but there's nothing getting upset under here. No, the tissue's pretty happy. And we like seeing that. We see this area of the frontal sinus. We certainly don't see all that soft tissue and gas density. Again, anything that's black is air in here. So this is improving a lot. We don't have the soft tissue density. Of course, the drain tubes are out.
And that's from infection, that soft tissue and the gases take
Well,
place?
it doesn't have to be, but in this case it certainly was, because we know we had all that pus in the pocket. And this pet was under anesthesia again at this time. That's where this line is. That's the trach tube. Now let's see if we move forward. We have another one. We can kind of rotate this around and get this up to full size. And here we see a more, it's easier to see that fracture on the right zygomatic arch. That healed. Do okay. It's okay. We'll keep track of that. And we're doing okay. Here's the area it's harder to see on the left side on that mandibular fracture. The dental occlusion is not bad. Teeth come together pretty nicely. And so I'm hopeful that we'll have a good situation for this baby. We're doing a lot better. Side of the jaw, and that is healing really nicely, and I do not believe we're going to need to do any type of surgery on that, at least at this point. So I'm really impressed.
When she picked Courage up originally, she just didn't think Courage was going to make it. When you first saw that dog, did you think, well, this chances are pretty slim that this dog's going to make it?
I thought he'd make it. I thought we could, as long as he could get that abscess draining, I thought he'd make it. I did. I didn't. I've seen things get bad, but I thought he'd make it. They have young cells. It's not an old dog. It was a baby. It's just a youngster.
On the plus side, like I said, we're healing, we're doing great, so we're on the up and up. To know that the outcome is going to be a positive for Courage is absolutely wonderful, and to know that we're part of this is wonderful as well. So we see nothing but good things for Courage.